Hi, everyone. My name is Myles Moody. I'm an assistant professor here in the Department of Sociology at the University of Alabama at Birmingham. And I just want to say thank you to everyone for the opportunity to present some of my research titled Examining How Vicarious Experiences of Discrimination Influence the Mental Health and Well-Being of Older Black Adults. And I was fortunate enough to receive a research supplement to promote diversity in health-related research through the Deep South RCMAR Center, where we were fortunate enough to get a P30 Center grant where Dr. Reagan Durant is the PI, and this research is also funded by the NIA. Now, as a medical sociologist by training, much of my research is inspired by and connected to stories and unfortunate tragedies that have happened throughout the public sphere. So I just want to take a quick second to dedicate this work to the life and the memory of Erica Garner, as well as the parents of Tatiana Jefferson, all who lost their lives after finding out about horrendous racial discrimination that occurred to their loved ones. Now, here's my agenda. I'm going to try to go through this presentation as quickly as possible. So please feel free to pause the video if I didn't spend enough time on the slides. Given that we have this recording feature, I think that this offers us a unique opportunity. So I'm going to try to go as quickly as I can. I've already done the brief introduction. I'm going to talk a little bit about racism-related stress, vicarious racism, and how we understand its impact on health so far, research questions, and then I'm going to talk about the data and findings from studies and papers that I've already submitted, and finally finish with some of my training objectives. So let's go ahead and define racism-related stress. Of course, we know racism can impact health through a multitude of ways, residential segregation being one of the largest, but I'm not going to be speaking about that today. Instead, I'm going to focus largely on racial discrimination or unfair treatment and racism-related stress and how they both impact health. So we know that racism-related stress, through the framework that was outlined by Dr. Shelley P. Harrell, a psychologist, we know that it's defined as the strain that racial and ethnic minorities endure because of chronic and acute experiences of racial discrimination, and that it's an added stress burden that is unique to minorities, and it can threaten their personal well-being. Racism-related stress, as we know, operates similarly to general stress, if you will. I'm going to go ahead and kind of breeze past this and get to vicarious racism, which is also outlined in that racism-related stress framework by Dr. Harrell, who asserted that racism exerts its influence not only through direct personal experience, but also vicariously through observation and report. And she defined vicarious racism as experiences of prejudice and discrimination that happen to members of one's family and close friends, as well as those events involving strangers. Now, when I started this research several years ago, I noticed that many systematic reviews and meta-analyses showed that the overwhelming majority of research on racism and health focused on direct exposures to racism, or in other words, those personal experiences of racism, and fewer studies focused on those indirect experiences of racism or group experiences, vicarious experiences of racism. Now, of course, since 2013, or rather I would say about 2015, 2016, this trend has begun to shift, and now more studies are including at least the vicarious component of racism. However, we know that racism has had a viral nature in the US. And I argue that this didn't begin with the rise in technology, where now people are able to record things on their smartphones and upload them and share them with the world. But I argue that this actually began during the Jim Crow era, and perhaps even before, where we know lynchings were very public spectacles. And then, of course, the media were sharing these horrible images of what was happening to Black folks and others in the United States. So I argue that since then, we have experienced vicarious racism, and those are just the experiences involving strangers. My research actually focuses on experiences through our loved ones, right? So let's actually get to some of that. So what we know about vicarious racism so far is that um, parents' experiences of discrimination can impact the health of their children. But also recently, we're starting to find out that children's experiences of discrimination can also impact the health of their parents. We also know that studies have shown that vicarious discrimination is associated with higher blood pressure. Um, in fact, one study found that vicarious discrimination had a larger impact on blood pressure than the respondents' own experiences of discrimination, and that vicarious racism is associated with genes that are linked to mood disorders. We also know that vicarious discrimination stress can increase disease activity. We saw this in a community sample of Black women who had lupus. Now, of course, many studies have been coming out since 2018, 2019, but this is just an example of how some of these studies are showing the links between vicarious racism and health. So for my research, I'm interested in how does vicarious racism shape the mental health and well-being of Black adults, particularly as they age. Here's my conceptual model for vicarious racism-related stress. And as you can see, of course, there's a life course component at the bottom. So what we know based on stress theory is that there are certain resources such as mastery, self-esteem, social support, even perhaps John Henryism as an active coping resource that can attenuate or even mediate some of these effects that racism can have on the health and well-being of Black folks, particularly as they move through the life course. And some of my research actually includes some resources, but let's go ahead and get to that. So, of course, my hypothesis that vicarious racism is associated with poor mental health and well-being is driven by the racism-related stress frameworks that I've outlined, biopsychosocial model of racism as a social stressor, as well as life course research, which includes a linked lives concept that says essentially that as we move through each stage of life, the adversity that our loved ones experience are likely going to impact us as well. Now, a little bit about the data that I'm using. The data are drawn from the Nashville Stress and Health Study, which was collected between the years of 2011 and 2014 cross-sectionally from individuals who are from Nashville and the surrounding areas within Davidson County, Tennessee. The age range is from 22 to 69. So unfortunately, I couldn't get to those older adults, but my research does focus on adults, particularly those who are in midlife. One of my most recent manuscripts, which I will share with you all in a minute, focuses on ages 50 through 69. Now, this data set, nonetheless, was still ideal for addressing my study aims, given that it has a unique discrimination measure that includes vicarious experiences of discrimination. And just to give you all a little snapshot, what this vicarious measure of discrimination includes is the major experiences of discrimination scale with items such as these. But what makes it unique is that they ask individuals or respondents in the study, has this happened to you, or have these events also happen to your spouse, your child, another relative, or friend? Okay, and that's what makes this this data set useful, particularly for my research. Now, I'm going to go ahead and skip ahead to the findings because I know I'm running out of time. So my first study, I did examine vicarious exposure to major discrimination and life satisfaction among Black and white adults. And this manuscript is actually in the revise and resubmit stage. Thankfully, I'm hoping that it gets published soon. And essentially what I'm doing is I'm doing a comparison between groups of Black adults and non-Hispanic white adults, where I found that just the prevalence alone of vicarious experiences of discrimination were statistically significantly different. And there was a much higher prevalence among Black folks, particularly among the items that capture those unfair experiences in the job market, as well as with law enforcement. And when I got to my linear regression models, what we found was, or what I found, excuse me, was that vicarious exposure to major discrimination was associated with lower levels of life satisfaction among Black adults, but there was no statistically significant association among white adults, essentially suggesting that, again, in line with what we know about racism-related stress as an added stress burden for racial and ethnic minorities, there is a negative association or negative impact, if I can use that word here, where racism, vicarious racism, impacts Black folks in ways that white people are not affected. Moving on, just in the interest of time, I also, with some co-authors, examined how vicarious experiences of major discrimination can lead to psychological distress among particularly Black men and Black women. And this is also in a revise and resubmit stage. And what we found in a comparison between Black men and Black women, looking at gender differences here instead of race differences, we found that one, of course, Black women reported statistically significant higher levels of psychological distress compared to Black men, which is consistent with stress theory, but also that the association between vicarious discrimination and psychological distress was significant for Black women, where it was associated with higher levels of psychological distress for them. But there was no statistically significant association among the Black men. Now, when we stepped away from the linear regression models and looked at the association at the bivariate level, there was a positive association for Black men, suggesting that perhaps there are some socio-demographic factors or other factors that may explain this relationship between these two groups. Now, I do want to move on to this third study where we looked at vicarious discrimination and anxiety and mental health care among Black adults. This is also in a revise and resubmit stage. And what we found was that vicarious experiences of major discrimination were associated with higher levels of anxiety symptoms. And when we did interaction effects and we observed those, we saw that those individuals who were able to get mental health care actually had lower levels of anxiety symptoms, suggesting that mental health care could perhaps be useful for Black Americans who experience racism-related stress, particularly if it involves culturally adapted strategies for addressing racism-related stress. And then there's another manuscript that I worked on with a co-author, recently just submitted, where we look at Black individuals ages 50 and older. And what they reported most commonly as far as vicarious experiences of discrimination were those experiences that their loved ones had unfairly through law enforcement and interactions with the job market. And we found that vicarious experiences of discrimination were associated with higher levels of depressive symptoms among this group. So as you can see, there is a growing body of research that I'm, hoping to contribute to. In my last minute here, of course, there is a training component to this diversity supplement. And essentially, what I'm hoping to be able to do is develop stronger skills in psychometrics and survey instruments, because I would like to develop one that is much more current for racism-related stress, and studies hopefully can incorporate that one day. And then I would like to also develop better skills in my secondary data analysis, particularly as it relates to multi-level modeling, social network analysis, and longitudinal data analysis. And then lastly, I would like to become stronger as a researcher in the design, for human subjects research, that collects primary data from racially and ethnically diverse community-based populations, because eventually I would like to earn a KO1 Early Career Development Award for this research. Here is my early career roadmap. And in the interest of time, I would just encourage you to, maybe take a pause if you can and take a look at this. It is very similar to what I showed on the last slide. Here are some of my takeaways. Of course, I mentioned much of this earlier, but what we know is that we must start to include vicarious measures of racism, or else we may underestimate the full toll of the racism-related stress experience. And thank you to you all.